inguinal ligament, and this one will be obliterated umbilical artery. Okay. Medial umbilical artery.
Ligament.
Okay, we'll see that later on. But first of all, okay, don't forget the things, understand the things. Okay. So we think that there is medial umbilical artery and lateral umbilical artery. Is it so? Now look at this. Umbilical cord, we think that there is a medial and lateral umbilical arteries. No. So okay, whatever here it is present is medial umbilical fold of the peritoneum. Fold. It's not the artery. Okay. The content is the umbilical artery. Okay. We will discuss in that tomorrow. Okay. But for now, this is the what is it? Obliterated umbilical artery. And this part is called, this fossa is termed as supra. Vesicular means, cycle means, cycle means urinary bladder. Supra-vesical fossa. Okay. Vesicular eruption, vesicular fossa. Vesicular eruption is if you get a, for example, if you have undergone a burns injury. So there you get a fluid-filled sacs over here. Those sacs are called the vesicular eruptions. That is different. Here it is vesical fossa. Supra-vesicular fossa over here. Okay. And then this one will be medial inguinal fossa, and this part will be lateral inguinal fossa. These things are very much important. So what the direct hernia, whatever the hernia occurring through these two areas is called the direct inguinal hernia, and whatever the thing which is present over here, the deep ring through which if the hernia occurs, that is termed as indirect inguinal hernia. So within the Hasselback's triangle, direct hernia; outside the triangle, indirect inguinal hernia. Okay. So the layers over here are first of all the peritoneum, parietal peritoneum, all the way from back to front. Parietal peritoneum, then followed by extraperitoneal tissue, then followed by fascia transversalis, within which this deep ring is present, and then followed by internal spermatic fascia, and then followed by cremasteric fascia, and then followed by external spermatic fascia, and then followed by darkness muscle and skin. Okay. Then through this, if it occurs, it will be going towards the cremasteric fascia over here. So if you add the cremasteric fascia and external spermatic fascia instead of all these things over here, then it will become the coverings of the hernia through this part. So what made the things over here? First of all, again, the parietal peritoneum, then followed by extraperitoneal tissue, then followed by fascia transversalis, and then followed by conjoint tendon will be over here. Okay, conjoint tendon will be over here. This one will be here will be after fascia transversalis. No. See, inguinal. Obviously, the muscles will be there. Tendon will be on the medial side. Tendon will be on the medial side, and here will be
Transfer.
next to the muscles. Sickness spermatic, fascia transversalis over here, and then followed by and then there will be arching of the fibers over here. So there will be a gap over here. So there will not be any tendon over here. And then followed straight away to the cremasteric fascia, and then external spermatic fascia, and then darkness muscle, and then the skin. So you understand. So the conjoint tendon will be present over here. Arching of the fibers will be occurring all the way from here to here in this manner. Getting it out? And then followed by the conjoint tendon will be over here, and reflected part will be coming all the way from here to here. Getting it out? Right? But this will be defined over here. Yes, absolutely. Okay, so see properly over here. So there is an arching of the fibers of the transverse abdomen is an internal oblique over here, and external oblique oblique will be obviously anterior it is located. Okay, so all the way from here to here, fascia transversalis, and then followed by cremasteric fascia over here, and then followed by external spermatic fascia and scrotum. Of course, doctors must have to skin over here. Understood? arching, there will not be any muscle fibers involved over here. Getting it or not? Right? So coming over here, then again from behind forwards, first of all the parietal peritoneum, extraperitoneal tissue, fascia transversalis, and then followed by the tendon will be involved over here, nothing but the conjoined tendon over here, and then followed by in front of that will be reflected part of the inguinal ligament over here, and even in front will be, we have already crossed the cremasteric fascia. Cremasteric fascia will be present over here, but here only external spermatic fascia is remaining over here. Could you understand? Right? And then followed by darkest muscle and the skin over here. Getting it or not? You would understand or not? Because inguinal hernia is a short nose. So next in the next exam it might come. Okay, because for the past years it is given over. It was given over. So these are the layers covering the hernia over here, and these are the layers covering over here. Okay, you have to add conjoined tendon and reflected part of the inguinal ligament towards the medianmost part of this Hasselback's triangle. That's all. Getting it all? The rest of the things are same. Understanding or not? Right? Okay. So have you read the defense mechanism of the inguinal canal? Defense mechanism. What is the defense mechanism?
There are 4 mechanisms.
What is it?
There are 4 mechanisms.
Okay. What's the defense mechanism? What's the need of defense mechanism of the inguinal canal? So that indirect hernia or direct inguinal hernia will not occur. Any hernia must be prevented. You know. So what will happen if a hernia occurs? What will happen? If you understand that, then you will understand why the hernia should not occur. Okay. First of all, for example, this is the superficial inguinal ring, for example. Okay. This is the inguinal ligament, for example. Of course, this must be the green color. Okay. For example, if the hernia occurs over here, Okay. Could you able to see that? This is the intestinal loop, one of the intestinal loop, which is covered by the peritoneum, fascia transversalis, all the rest of the layers over here. Imagine that direct inguinal hernia or indirect inguinal hernia will be passing outwards through the superficial inguinal ring. Is it the right? Right? Okay. So whenever this occurs, you can see that there is narrowing of this intestinal lumen. Is it not? When the tubes are coming over here, this much wider tube has become narrowed over here because it's a small opening. And this much wider tube, it has become narrowed over here. Could you even understand? So whenever there is a compression at this level occurs, what will happen? What is compartment syndrome of the forearm? What is the compartment syndrome of the forearm? Based on this mechanism, you can understand. What is it? What? Compartment syndrome of the forearm. What is happening over there? No? No idea. Okay. Roughly I'll tell you. For example, you are going through a forest or something like that. A small thorn has pricked to your skin. Okay. It went deep to the muscles, for example. Okay. So what will happen? You will remove the thorn, but the infection what has entered, what are the microorganisms entered into the forearm over here will be remaining over there. Okay. Later on the skin will heal and everything will heal, but the infection will still within the forearm. So what will happen? That infection, that nothing but the bacteria will be multiplying. So that will produce pus over here. Is it not? Okay. So because this is a closed cavity, because it has reached the muscles over here, okay, the deep fascia will be there. So the deep fascia will be on the outer aspect of the muscles. So if this is my hand is the muscle and this is the deep fascia. In between these two, there will be infection development over here. The proliferation of the bacteria occurs over here. So the space will be completely occupied by the pus over here. So what will happen? This pus applies pressure over the lateral aspects. That means whatever the walls towards the skin, over which the pressure will be applied over here, just like the blood pressure. So when the pressure is applied towards the lateral aspect, what will happen? The veins will be compressed over here, arteries also will be compressed over here. So what will happen? The venous drainage will not occur over here, so there will be edema over here. And arterial supply will not occur here, so there will be ischemia. So this as a whole it is termed as a compartment syndrome. So compartment, flexor compartment syndrome. Extensor compartment syndrome. It is a thing over here. Getting it now? So because of this pressure, the vessels will be narrowed and the blood supply to and fro will be stopped. Okay. In the same manner, if there is a narrowing occurring over here, what will happen to the rest of this part over here? So there is a narrowing or compression occurs at this small opening over here to this wider lumen. So there is a compression of the intestines, walls over here. So what will happen to the rest of the intestine over here? Absolutely. So this part of the intestine will undergo ischemia because of the blood vessels will be compressed over here. So the ischemia occurs, necrosis will occur over here. So necrosis occurs, so obviously the infection will occur over here. You know? So that infection will be spread throughout the body and the patient will die. Okay, or this infection will be entering into the abdominal cavity and will be causing the generalized peritonitis, which is an emergency situation. You know? So if the infection spreads to all the other regions of the body, all the other organs will be flooded with the infection and the patient will die of multi-organ dysfunction. So the multiple organs are failed over here, so the patient will die. So this is the ultimate fate of this hernia over here. So, okay, in another manner, there is a twisting of the intestines. Whenever it is entering over here, there occurs twisting. These loops will be twisted over here. You know? So whenever this twisting occurs, again there will be narrowing, much more narrowing occur, again necrosis will occur over here. So again the blood supply will be lost over here. Understood or not? So this is the complication of the hernia, normally, clinically. Okay. For that sake, what we are supposed to do, initially whenever the patient comes, we have to push back the intestines back into the abdominal cavity, and then we have to repair the abdominal wall over here. That means, for example, if you put a mesh over here, mesh is like a, you know the gauze, have you ever seen the gauze? During injury there will be a small bottom sort of, okay. That if it is made up of a small metal, that is called a mesh over here. It will be the same manner, same texture also, okay. But the material will be different, okay. So if you put a small mesh over here, this will undergo fibrosis. Why? Because whenever we put a mesh over here at this level, anti-abdominal wall, within the deep to the skin, this will undergo fibrosis. Why? Because it is a foreign body to our body. Okay. Whenever a foreign body enters anywhere in the body, so that will undergo fibrosis as a part of inflammatory reaction. Okay. So this will undergo fibrosis. Now a solid fibrous membrane will be situated over here after some days. So what will happen? This will strengthen the anterior abdominal wall, so the hernia will not occur. Getting it on? So this is actually repair of the hernia. Okay. So this is what the surgeons will do. But naturally, what is happening over here, you are supposed to understand. That is called the defense mechanism of the inguinal canal. That means how the abdominal wall muscles or whatever the things which are preventing the hernia from occurring over here. Getting it on? Right? So how the hernia occurs normally in case of children, the hernia will be, because in case of children, the abdominal muscles will not get developed. Isn't that? Later on, the muscles will develop. Isn't that? For example, you see the umbilicus of the children, it will be close towards the pelvis symphysis. Isn't that? Because the pelvic cavity has not yet developed. Okay. So because the abdominal muscles are not yet developed over here, there is not differentiation of the obliquity of the inguinal canal. Getting it? In case of children, because of the abdominal wall muscles are not yet developed, the inguinal canal will be straight. So easy access to the indirect inguinal hernia over here. Getting it? So in case of children, the indirect inguinal hernia is more common. Getting it? Right? In case of adults, what will happen in case of adults means like 60 years or 80 years sort of individuals, the anterior abdominal wall muscles will be weakened. Isn't it? The degenerative changes and everything, you can see that the skin will be hanging, the abdominal skin will be hanging downwards in case of older people. Isn't it? So the anterior abdominal wall muscles are weaker in case of elderly people. So which hernia is most common in adults? Direct inguinal hernia through the Hasselback's triangle. Getting it? So this indirect inguinal hernia in case of children, but direct hernia occurs in case of elderly people. Okay? Elderly people. Okay? So that's why we are strengthening the wall with the mesh over here. That's a different thing. Okay? So to prevent the hernia from occurring, either indirect or direct inguinal hernia, what are the mechanisms over here? What are the mechanisms here?
Flap valve mechanism, ball valve mechanism,
Okay.
shutter valve mechanism.
Okay. Yeah. First of all, let us discuss one by one. Okay. What is flap valve mechanism? So in case of adults, generally, the inguinal canal will be obliquely situated. Is it not? From the deep ring towards the superficial. Right? So this obliquity is because of the development of the abdominal wall muscles over here. So if you think that the anterior wall will be over here and the posterior wall will be over here. Is it not? Is it not? Right? So behind that will be the fascia transversalis, extra vertebral fat and everything over here. So the anterior wall will form laterally and posterior wall will be formed medially. Is it not? So and then in between these two, this is the inguinal canal which is obliquely situated in this manner. Okay. What is flap valve mechanism? Whenever To contract the abdomen, this anterior and posterior walls will be coming close to each other, closing the inguinal canal. So whenever this is closed, the inguinal canal got closed over here. So the indirect inguinal hernia will not occur. Could you understand or not? Right? So the anterior wall over here, and the posterior wall over here, whenever they are becoming occluded, coming close to each other. So this canal is closed. Could you understand or not? Everybody could able to remember the anterior wall and posterior wall or not? Right? So the anterior wall is formed by external oblique, and then followed by internal oblique, only little part towards the lateral aspect. So this forms the anterior wall. And posterior wall? Here the fascia comes here, the muscles will see that one joint tendon and reflected part of the inguinal ligament. So this is on the posterior aspect towards the medial aspect, and this is on the anterior aspect towards the lateral aspect. So this both will be coming close to each other, closing the inguinal canal. So there will not be any space in between the canal. So the inguinal hernia, the indirect inguinal hernia will not occur over here. Okay, and then followed by that is called the which mechanism? Flap valve mechanism. These mechanisms are very much important. This is a short note. It's typically given as a short note. Either indirect inguinal hernia or direct inguinal hernia, or these mechanisms, defense mechanisms, individually they will be given as short notes or 4 marks. Okay. Then followed by
Ball valve.
ball valve mechanism. Okay. Ball valve mechanism. What is this ball valve mechanism? Cremastric muscle. How the cremastric muscle is situated? Study it out. So let's see that. So what do you understand by this? You can understand what you understand. Testis and then followed by spermatic cord over here. Testis and then followed by spermatic cord. Okay. So this spermatic cord is surrounded by loops of a muscle called cremastric muscle. Okay, what is that muscle? Cremastric muscle. This muscle has see here, you know the what is fasciculus means of a muscle? You know the fasciculus of a muscle? Absolutely. Muscle fibers whenever they piled up together, that is called the fasciculus. Okay, histologically. Okay. So you see that cremastric muscle is a muscle derived from the internal oblique alone or internal oblique and transabdominis together. Okay, you know. Cremastric muscle is a derivative of internal oblique alone or internal oblique plus transabdominis together. Okay. So you can see, you can understand that the origin of the internal oblique will be around some 2/3 part of the inguinal ligament, isn't that right? And then transabdominis will be over here, later over here. Okay. So you can understand that this cremastric muscle is having two fasciculi. Could you ever see that? This is one fasciculus and this is another fasciculus over here. What's that? How it is located? Anterolateral fasciculus, anterolateral. For example, it is in this manner. For example, if this is in this manner, anterolateral fasciculus, anterior and lateral fasciculus, and posterior-medial fasciculus, posterior and medial fasciculus. It will be in this manner. Okay. So it will be holding the spermatocord in this manner. Could you understand? This is the spermatocord. It will be holding the spermatocord or attached to the spermatocord in this manner. Anterolateral and posterior-medial fasciculus. Okay. So this is anterolateral fasciculus, which will be arising from the inguinal ligament. In the middle 1/3 of the inguinal ligament, there will be origin of the anterolateral fasciculus over here, and the posterior-medial fasciculus will be attached to the pubic tubercle over here. Is it not? Pubic tubercle, of course, a little bit of pubic crest, and of course, pecten pubis also. We have already discussed. Okay. So this is a cremastric muscle over here, which is having these two fasciculi. Okay. What is the use of this cremastric muscle? Whenever this muscle contracts, what will happen? It will pull the spermatocord upwards in this manner. Obviously, the testis also will be pulled down. Okay. This you can see in case of males, obviously, especially during winter season. So, is it not? The testis will be moved upwards. Okay. So whenever the testis is moving upwards and blocking this superficial inguinal ring, again the hernia will not pass through this superficial inguinal ring. Could you able to understand about it? So whenever the cremastric muscle is contracting over here, the spermatocord will be moved upwards and testis also will be moved upwards, because it will be like a sac pulling the testis upwards in this manner. Okay. So this testis can't pass through this superficial inguinal ring. Is it not? Initially, earlier days, it might pass whenever the size is less, but when in case of adults, it will be enlarged, so they can't pass through the superficial inguinal ring over here. Do you understand? Okay. So this will be plugging the superficial inguinal ring over here, obstructing the superficial inguinal ring, so the hernia will not occur, whether it is a direct hernia or indirect inguinal hernia. So it is acting like a ball over here. So that's why it is termed as ball valve mechanism over here. Do you understand or not? Flap valve means the anterior and posterior valves will be coming close to each other, and ball valve means the testis will be obstructing the superficial inguinal ring, and then followed by shutter mechanism or shutter mechanism. How the shutter mechanism occurs over here? Absolutely. This arch is present over here. That will be closing the inguinal ligament. That means it will be coming close to the inguinal ligament over here, closing the inguinal canal again. Do you understand? So these arch fibers of the internal oblique transverse abdominis over here, they will be like, for example, this is the inguinal ligament. The arch fibers are in this manner. Is it not? Through this passes the inguinal canal. Is it not? Right? Because this arch fibers forms the roof of the inguinal canal. So here is the inguinal canal. In between these two hands is the inguinal canal. So whenever these arch fibers are coming in contact with the inguinal ligament over here, it is closing the inguinal canal over here again. Okay. So again the hernia will not occur. Is it done? So which hernia will not be occurring over here? Okay, indirect you can say, indirect you can say, and then which direct you can say? Absolutely. This lateral part of the direct inguinal hernia and indirect inguinal hernia both will not occur because of the shutter mechanism over here. Getting it out? Right? Because the conjoint tendon reflected part of the inguinal ligament are present towards the medial aspect, this will not be obstructed. Okay, maybe or may not be obstructed based on the weight of the hernia over here. Okay, but this will definitely be obstructed over here. Do you understand? Right? So this is about the shutter mechanism, nothing but the because of the arch fibers of the internal oblique and transverse abdominis. Okay, so whenever and then followed by next mechanism is what is slit valve. Okay, slit valve. What is the slit valve? What is slit valve mechanism?
So the muscle will be contracted. So the aponeurosis part, the external of the aponeurosis part will be stretched.
Stretched. Stretched we can say.
So superficial inguinal ring will be constricted or obstructed.
Sorry. So we have the abdominal wall muscles. Whenever you contract the abdomen, what will happen? What will happen? So the rings will become narrow. Could you understand? Because of the pull of this muscle, there will be narrowing of the what is this? Superficial line. So it will be pulled in this manner. So when initially it is broader, now it is becoming narrower over here. is a slit valve mechanism. Slit valve mechanism. Very nice. Because of the action of the external oblique muscle over here. Could you understand? Just like how you can say diaphragm, whenever it is contracting, it is dilating the vena cava opening so that the venous wall will be opened up. So the blood will be more reached to the right atrium. The same manner over here. Getting it now? So whenever the external oblique is contracting, it will pull the aponeuros in this manner. So the slit will become narrowed over here. So obviously the hernia will not occur. Any other? Any other? Any other is there? The strength of the muscles. What is the strength of the muscles over here? The posterior wall is strengthened because of this conjoint tendon reflected part of the inguinal ligament, and towards the anterior aspect there will be external oblique, internal oblique muscles which will be strengthening the canal over here. Is it not? Both these also will be preventing. In case of young adults, it will be preventing the hernia. But in case of older adults, these walls will become weaker, so the hernia will be easily appearing over here. Could you understand or not? Right? Any other mechanisms there? Any other that's all. So these mechanisms are very much important for the short notes. That's not done. Okay. So let us see the origins and insertions of these muscles here. A little bit over here. So external oblique, origin and insertion. What are you going to say? External oblique. Lower 8 ribs from external surface or internal surface?
External lateral.
External surface or internal surface, right? External surface or internal surface of the ribs? So it is anterior, external surface or internal surface? Based on the sequence. So it is anterior, redistributing with the external oblique. So obviously the external oblique also from the external surface of the ribs. Lower 8 ribs. Is it not? Number 4 ribs will be redistributing with. So it is anterior, lower 4 ribs. That is first dorsal. Okay, insertion will be. Insertion will be. Insertion will be. Okay, that's okay. The muscular part will be inserting into. See the thing over here is external oblique, internal oblique and process abdominis. External oblique will be coming from above and will be inserting below and towards the linea alba. Okay. And internal oblique and process abdominis will be arising from below and will be inserting above and into the linea alba. As simple as that. Right? External oblique from above downwards, internal oblique and process abdominis from below upwards. And of course towards the medial aspect also. Okay. Internal oblique will be arising from inguinal ligament lateral to third and iliac crest also, and of course there is a thoracolumbar fascia, anterior and middle layers of thoracolumbar fascia wherever it is joining over here. It should be covering which muscle?
The quadratus lumborum.
Quadratus lumborum is covered by which layers of the anterior and middle layers. Posterior layer will be covering
Erectus spinae.
This part is very much important. And will be inserting into internal oblique will be inserting into linea alba. Whatever the aponeuros is entering into the linea alba. The linea alba, that will be the insertion. Yes. Okay, and then process abdominis will be arising from
Lateral one third of the inguinal.
Lateral 1/3 of the inguinal ligament over here, and then followed by iliac crest, and then followed by what? Thoracolumbar fascia. Very good. And then one more. Any other else is there? Lower 3 to 4 ribs. Lower 3 to 4 ribs also gives rise to the transverse abdominis. Transverse abdominis will be coming all the way in this manner, above, downwards, and towards the medial aspect. Could you understand? Above, downwards, and towards the medial aspect. Getting that's why it is transverse. Getting it now, right? Okay. The anterior abdominal wall is strengthened by muscle called the rectus abdominis over here. And then what is the action of the pyramidalis muscle? Rectus abdominis, okay. What are the actions of these muscles? External oblique, internal oblique and transverse abdominis?
Separation of the
External oblique. Whenever they are acting together and on one side. Whenever they are acting together, what will happen? Flexion of the which vertebra? Which vertebra? Which vertebra? You can flex the thorax also. You can flex the thorax also. You can flex the thorax also. You can flex your trunk at the level of lumbar vertebra. Isn't that? You can flex the thorax and you can flex the trunk at the level of lumbar vertebra. You are not flexing this part. You know? Divided into two parts, you can't flex this part. Right? Right or not? Right? So flexion of the lumbar, whenever both the muscles are active together, what will happen? What will happen? For example, internal oblique and transverse abdominis are attaching over here, external oblique is attaching over here. So whenever they contract together, what will happen? They will shrunk in over here, so obviously the trunk will move forward. So obviously this is called the flexion of the lumbar vertebra. If only one-sided muscles are contracting, that is towards the right side external oblique, internal oblique and transverse abdominis, whenever they are contracting in this manner, what will happen? You can see, bend side, and you can see which ones are contracting. Lateral flexion of the lumbar vertebra. You can flex towards the lateral aspect. You can flex towards the lateral aspect in this manner, and you can see which muscles are contracting, which muscles are relaxing over here. Which muscles are contracting and relaxing? Lateral flexion of the trunk. You can contract your one-sided abdominal muscles and see the movement. You can see the movement now. Which muscles are contracting? Leo, what the things? Leo, internal oblique or external oblique, what are you trying? One-sided muscles, you try to contract everything. Try to contract everything on one side. One side, could you able to contract or not? Could you able to contract or not one-sided muscles? Or you try to do the lateral flexion, you can see the contraction of which muscles are occurring over. Which sided muscles? Which sided muscles are contracting? Obviously, that's what I'm saying. So if one-sided muscles are occurring over here, one-sided muscles are contracting over here, to that side there will be flexion of the vertebra, lumbar vertebra. Okay, so this is called lateral flexion. This is called flexion of the vertebra over here. This is called the lateral flexion. This is towards the lateral aspect. This is the lateral flexion of the vertebra. So one-sided muscles, if they contract, what will happen? All the muscle fibers will become shorter. Is it not? The contraction is the shortness of the muscle fibers. So all the muscle fibers will contract in this manner. So obviously the trunk will be moved in this manner. So lateral flexion will occur. Getting it now? So there is one more thing called whenever the two muscles on both the sides are acting together, what will happen? Like rotation will happen. So external oblique on this side and internal oblique on this side. Let us see the contractions for example. External oblique, for example, if it is pulling in this manner. So internal oblique, what will happen? Because it is contracting in this manner over here, So it will pull the body in this manner, and external oblique, what will happen? External oblique, what will happen? It will be contracting in this manner, right? External oblique will be contracting in this manner, and internal oblique, both are acting together over here. What will happen? Rotation will happen in this manner. So whenever the two muscles, two-sided muscles are occurring over here, rotational movement will occur. Could you understand? So one-sided muscles are contracting, so that's a flexion will happen. So if both-sided muscles are contracting together, not acting, agonistically, so what will happen? The flexion of the lumbar vertebra will happen over here. Is it not? Understood not everybody, right? So okay, these actions are fine. But the main thing is the derivatives of the inguinal ligament. These things are very much important, okay? So the inguinal ligament is nothing but the lowermost folded portion of the external oblique aponeurosis. How it is folded? Whenever the aponeurosis will be coming downwards, it will be folded on the inner aspect. For example, if it is my external oblique over here, it will be folding on the inner aspect in this manner. Could you understand? And the folding also occurs in an oblique manner. That means initially it will be folding horizontally, then it will fold obliquely in this manner. Could you understand? So, but the folding will be inwards. Getting it out? So, whenever it is folding in this manner, it will form a groove above it. Is it not? This is the entire inguinal ligament over here. Whenever it is folding in this manner, there will be a groove over here, over which The medial half will be carrying the inguinal canal over here. Could you understand? Right? So, what are the derivatives of the inguinal liquid? That is very much important, and the shortcuts are what are required. First of all, what is that, right? Lacunar ligament. So this is the lacunar ligament. See properly, everybody. This is the inguinal ligament over here. So lacunar ligament means a triangular expansion of the medialmost part of the inguinal ligament. Could you understand? So this is the entire inguinal ligament. The medialmost part or medial end of the inguinal ligament is giving rise to a triangular expansion in this manner. Getting it out? So this is the base of the lacunar ligament, which is also termed as Gimbernat's ligament. These other terminologies are very much important. What is it? Gimbernat's ligament. Anywhere, other terminologies are very much important. Try to understand. Okay. So this lacunar ligament, the base will be concave in shape. Could you see that? This is the concavity of the base of the lacunar ligament. So this will be attached to which part of the pubis? We have already discussed. What is it? Pecten pubis. If you imagine there is a lateral part of the pecten pubis and this is the medial part of the pecten pubis, the medial part of the pecten pubis will be giving attachment to the what is it? Lacunar ligament over here. And the apex is attached to pubic tubercle over here. Could you understand? Could you imagine that? Right? Right. This lacunar ligament also forms what is it? The floor of the inguinal canal. Very good. The inguinal canal will be coming in this manner and it will be lying over the medial half of the inguinal ligament and also over the upper surface of the lacunar ligament over here. Could you understand that? Right? And what is another derivative is pectineal ligament of Cooper, this extension over here. This lacunar ligament, wherever it is extending over the lateral part or lateral half of the pecten pubis over here, that is nothing but the ligament of Cooper. Ligament of could you understand? Pectineal ligament of Cooper. Okay. So the medialmost part is nothing but the lacunar ligament. From the lacunar ligament, if the end, one of the end goes towards the lateral half of the pectineal line or pecten pubis over here, that is nothing but the ligament of Cooper over here. Okay. There is no specific significance for that. And then one more thing is nothing but reflected part of the inguinal ligament. Okay. This reflected part of the inguinal ligament will be arising from, for example, this is the superficial inguinal ring, for example. This is the superior crest and this is the inferior crest, for example. From the inferior crest, there arises multiple fibers in this manner. Okay. And this will be forming the reflected part of the inguinal ligament in this manner. Could you understand? Okay. This reflected part of the inguinal ligament on one side will be joining with the opposite side reflected part of the inguinal ligament over here. Could you understand? Okay. Here will be the linea alba. Here will be the linea alba over here. So in front of the linea alba there will be joining of both sides. What is this? Reflected part of the inguinal ligament over here. Okay. So it is reflected all the way from inguinal, this thing, the inferior crest towards the midline, linea alba over here, and joins with the opposite sided reflected part of the inguinal ligament. So what might be the use of this over here? Absolutely. Strengthen the wall of the anterior wall of the abdomen over here. Is it not? Is it not? Right? So because there will be rectus abdominis over here and of course there will be opponents over here, extra added thing will be this reflected part of the inguinal ligament over here, just to support the lower part of the abdominal wall over here in the midline. Could you understand that? Right? Okay. There are some important points about the fascia over here. Muscles we have discussed. Extrapyramidal part, nothing is there. Fascia transversalis is just a fascia. Fascia transversalis is through and through. Could you understand? External oblique, internal oblique, and transverse abdominis all are two sides. Okay, two sides. They will be joining in the middle. But in the middle there will be linea alba. Behind the linea alba, fascia transversalis will be continuous with each other on either side. Could you understand? Fascia transversalis is not present on right side and left side. It is like a cylindrical structure over here. Okay, it is continuous. Okay. So behind the linea alba, which structure is present? Fascia transversalis is present. Again, behind the fascia transversal is extraperitoneal tissue, and behind that will be parietal peritoneum will appear. Could you understand? So behind the linea, in front of the linea alba will be the skin, and of course the umbilicus will be there over here. And behind the linea alba will be fascia transversalis and extraperitoneal tissue and parietal peritoneum. This you are supposed to understand. Understood or not, right? About the superficial fascia. What about the superficial fascia?
Campus fascia and stratus fascia.
Okay, very good.
Superficial is the campus fascia.
Okay.
To that is the stratus fascia.
Okay.
The campus fascia is the parietal.
Okay, very good.
And the stratus fascia will be.
Sorry, let's see that. See everybody, let us see the superficial fascia. There is an important clinical issue over here. So this is a what's an iliac crest on either side. This is the right side iliac crest. This is the left side iliac crest. And anterior superior iliac spine, anterior inferior iliac spine, and this is the rest of the part over here. Okay. So if you join both the anterior superior iliac spines with a line, imaginary line over here, above this level there will be only one layer of the fascia, superficial fascia. Below this line it will be divided into two layers. Those are nothing but the superficial, camper, and then followed by deeper scarpa fascia. Okay. So till this level, whenever you draw a line joining the anterior superior spines of both the sides, above this line will be single layer of superficial fascia, but below this layer it is divided into, below this line it is divided into superficial fascia of Kemper and deeper fascia of scarpa. I have shown you two layers from that level. Okay, from the incision level, two layers are there. Okay. So this superficial campus fascia, whenever it is reaching the scrotum over here, this is the scrotum over here. Okay. So scrotum contains which muscle? Dartos muscle, which is responsible for the folds of the scrotum. Scrotum, which will be thrown into multiple folds. Those folds are produced because of this dartos muscle. Do you understand that, right? Okay. So this fascia, this superficial campus fascia, whenever it is reaching towards the scrotum, that will be replaced by this dartos muscle. Getting it or not? So the fascia of Kemper is replaced by dartos muscle in case of scrotum. This is an important vital question. Right to understand this. Okay. So fascia of Kemper is replaced by dartos muscle in case of scrotum. Is it not? Because anterior abdominal wall is very much close to the scrotum over here. The continuity will be occurring over here. Getting it or not? So this is about the scrotum, but this part it will be going towards the thigh. The superficial fascia of thigh will be continuous with this entire superficial fascia over here. Could you understand? Whenever it is going towards the thigh, this same two fascia will be continuous. Sorry, this fascia of Kemper will be continuous with the superficial fascia of the thigh over here. But this fascia, campus fascia, is replaced by dartos muscle in case of scrotum. Understanding or not? Right? And coming to the scarpa's fascia. This scarpa's fascia will be going into the scrotum, enclosing the dartos muscle over here, and behind, whenever it is reaching the perineum. What is perineum, right? Any idea?
Below the pelvic diaphragm.
For example, see over here, this is the pubic symphysis over here, this is the sacrum and coccyx together. Okay, this is the pelvic cavity, this is the pelvic inlet, and this is the pelvic outlet. Okay. Okay. So here you can imagine what are the things over here. For example, the urinary bladder will be over here in this manner. Okay. And then if there is a uterus, that will be in this manner over here. Uterus will be in this manner, and then followed by the rectum, which will be going. Do you understand? So this is the pelvic cavity which contains the urinary bladder, and in case of females there will be uterus and cervix and vagina over here, and then followed by behind it this rectum over here. Okay. So here in between, the rectum and rest of the organs over here, there is a body called the perineal body. Okay. What is perineal body? We'll be discussing about that later. Okay. First of all, there will be perineal body which supports this entire structure over here. Try to understand. Okay. This is the perineal body, for example. Okay. So at the floor of the pelvic cavity, there is a body called the perineal body. So this entire region is termed as the perineum. So you can understand. This is the scrotal region. This is the anal region. In between the scrotum and the anus, this part is the perineum. Could you understand? Or in between the genital region, either females or males, and the anal region, there is an area over here below the thighs. In between the thighs and below the pelvic cavity. This area is termed as the perineum. Get me down? Okay. This perineum is lined by a fascia that is called the fascia of Pulleys. This is known as Pulleys fascia. So this fascia of Scarpa will be continuous with the fascia of Pulleys over here. Could you understand? Scrotum will be in this manner, for example. So the superficial fascia will be coming over here and will be continuous. Whenever it is enclosing the entire dartos muscle within the scrotum and goes backwards and continues with the Pulleys fascia over here. Could you understand? Right? So here will be the genital region. Nothing but, for example, the penis is coming over here in this manner. This is the scrotum over here. This is the dartos muscle covered by this fascia of Scarpa, and that Scarpa will be continuous with the fascia of Pulleys within the perineum over here. Could you understand? Right? So here one thing you are supposed to understand. Try to understand over here. Okay. So this is the perineum. Okay. So I have told you already. This is the anal region over here. This is genital region over here. In between these two, below the pelvic cavity is the perineum. Okay. So this perineum contains two pouches. One towards the skin is called this is the skin over here, obviously. So okay, this is the skin, for example. This towards the skin is this part is nothing but the superficial perineal pouch. There is one more sac deep to it. This is called the deep perineal pouch. Deep perineal pouch. P-E-R-I-N-E-A-L. Perineal pouch. Two pouches within the perineum. One towards the skin superficially. Towards the skin is obviously superficial. Superficial perineal pouch. And deep to that there will be one more pouch called the deep perineal pouch. Okay. There are a few muscles over here. You will understand that later. Okay. For example, the urinary bladder is present over here in this manner. For example. The urethra will be passing through this, and will be entering into the penis over here in this manner. Do you understand? This is the track of the urethra. Do you understand? Right? So this is the urinary bladder above the deep perineal pouch, passing through. The urethra part will be passing through the deep perineal pouch and entering into the superficial perineal pouch, and then entering into the urethra, and then finally into the urethral opening outside. Get it out? Right. So now you are supposed to understand a point over here. If there is any injury to this part of the urethra, where is that injury? This injury within the superficial perineal pouch. Okay. So whenever this urethra is getting injured over here, the urine will be collected over here in the superficial perineal pouch. Is it not? Is it not? So whenever the urine is collecting over here, that same urine will be reaching in between the fascia of Scarpa. For example, this is the fascia of Kemper and this is the fascia of Scarpa over here. Both are united above over here. So in between the superficial fascia and the external oblique upon urine is over here. Is it not? First of all, the skin, superficial fascia, and the muscles. So obviously, the external oblique aponeurosis. So external, for example, this part is the external oblique aponeurosis, external oblique aponeurosis over here, and this part is the fascia of scarpa over here. Could you understand? This part is the fascia of scarpa. Okay. This part is the fascia of scarpa, and this is the fascia of Kemper, which is continuous and which is replaced with the darkness muscle in the scrotum over here. Could you understand? So see this purple colored dots over here. So in between the superficial fascia and the external oblique aponeurosis, there is a small space over here. Could you understand? So that space is continuous even till the superficial perineal pouch. Could you see that? The same superficial perineal pouch is communicating with the space in between the superficial fascia and the external oblique aponeurosis over here. Could you understand? That is currently superficial inguinal space, superficial inguinal region space in between the structures, in between the external oblique aponeurosis and superficial fascia. Do you understand? External oblique aponeurosis and superficial fascia. There is a space over here. This space is communicating with the superficial perineal pouch over here. So if there is any injury to the urethra over here, the urine will be extravasated over here. That means urine will be collected within the superficial perineal pouch, just above the skin over here. Okay. The same urine will be reaching the anterior abdominal wall in between the superficial fascia and the external oblique aponeurosis over here. Getting it out, everybody? Okay. So this is one clinical implication over here. So if there is any injury to the urethra from below, for example, if a person is falling from a height, below he hit a sharp object over here, that will be injuring the urethra over here. So the urine will be reaching over here. Whenever the urine reaches over here, what will happen? Urine will be having all the toxic substances and the bacteria, of course. So that will be infecting the entire abdominal cavity through the peritoneum and everything. Getting it out? Through the external oblique, internal oblique, peritoneum and everything. So this is the problem whenever there is an extravasation of the urine over here. Getting it out? So this communication is problematic in case of any individual. Getting it out, right? This is about the superficial fascia. What about the deep fascia in the abdomen, right? No deep fascia. Why no deep fascia? Expansion. Expansion of the abdomen will not happen. And one more thing is just below the inguinal ligament there will be fascia lata. Do you understand? Fascia lata, what are the things from where it is arising over here? Fascia lata will be arising from outer lip of the iliac crest and then followed with the inguinal ligament and then followed by pubic crest also, anterior aspect of the pubic crest. So this is the continuity. No, this is the pubic crest over here, then followed by the inguinal ligament, and then followed by the outer lip of the iliac crest. Is it or not? What is the fascia lata? Fascia lata, like for example, I am wearing a trouser over here. The fascia lata will be in the same manner. My sleeve, for example, my lower limb, for example, is coming out. So this sleeve is nothing but the fascia lata in case of lower limbs. Could you understand? Okay. So it will be like cylindrical in this manner. Could you understand? So obviously cylindrical iliac crest, which is present over here, and then followed with the inguinal ligament over here, and then followed with the pubic crest over here. Could you understand it? Right? So this is the origin of the fascia lata all the way from inguinal ligament. So because of this fascia lata presence, the inguinal ligament will be oblique on the lateral aspect and horizontal on the medial aspect. Could you understand? Because of the stretch of the fascia lata over here, the lateral part of the inguinal ligament is obliquely directed in this manner, and the medial part is horizontally directed in this manner because of this fascia lata. Getting it out? Okay, inguinal ligament is never straight in this manner. Okay, it is oblique on the lateral aspect and horizontal on the medial aspect because of the pull of this fascia lata over here. Getting it out, right? Anybody? Iliopubic ligament. Anybody could able to say? Iliopubic ligament. Inguinal ligament in the same manner. Iliopubic. Iliopubic ligament is nothing. See here. The anterior superior iliac spine again. Anterior superior iliac spine again. The pubis. So the fascia transversalis over here. Okay, iliopubic ligament is nothing but the fascia transversalis. Okay, the fascia transversalis, whenever it comes down to the lowermost aspect of the abdomen, okay, just behind the muscles over here, external, enteropic and trans abdominis, towards the posterior aspect, the fascia transversalis will be thickened in between the pubis and the anterior superior iliac spine, like a fold of the fascia over here, or thickening of the fascia over here. That ligament is called iliopubic ligament, just to support the abdominal wall from the posterior aspect. Could you understand? Anterior it is supported by the inguinal ligament over here. Okay, inguinal ligament is supported on the anterior aspect by means of inguinal ligament. Just behind the muscles, there is a fascia transversalis. That fascia transversalis will become thickened at the lowermost part behind the muscles over here, in between the anterior superior iliac spine and pubis over here. Okay, so this thickening of the fascia is termed as the iliopubic ligament over here. Understood? Okay, so one is the inguinal ligament, one is the iliopubic ligament. Okay. For example, okay, almost all at the same place. So the inguinal ligament from anterior superior spine to the pubic tubercle on the anterior aspect, and towards the posterior aspect will be iliopubic ligament. Okay, so in between the inguinal ligament and the pubis over here. For example, this is the pubis, and here the ilium, and of course the iliopubic eminence and the pubis over here. This obturator foramen is in which shape in case of females and in males? Triangle in case of females, oval in case of males. Okay, this is one more differentiating feature. So everybody could able to see there is a space between this entire hip bone on one side and the inguinal ligament. This space, you know, could you able to see that? Huh? The space is present in between the inguinal ligament and this bone. This space is filled with certain structures what you are supposed to know. Okay, what are those? First of all, from the median to the lateral direction, for example. So first of all, we can see the lacunar ligament. Is it or not? This is the lacunar ligament over here. And then followed by the, what is this name? Pectineal ligament of Tubercle. You have to imagine at this level. Okay, just I'm putting a bit behind over here. Okay, so you can see a gap over here. Could you able to see that? This is a gap. Is it not? Just behind the inguinal ligament, there is a gap over here. Okay, which is made up of two layers over here. Right to understand this, very much important. So there is a ring-like opening over here, just lateral to the lacunar ligament over here. Okay. So this ring over here, whatever you are seeing, is made up of two layers. One is the posterior layer and one is the anterior layer. So these two layers are called the femoral. These two layers together is called femoral sheath. What is it? Femoral sheath. This femoral sheath is made up of two fascia. What is the two fascia over here? See here, everybody. This is very much important. Okay. Femoral sheath. Okay, that will be carrying the femoral vessels and nerves over here. What is that? Femoral vessels and nerves. Okay. So you can see that it can straight away will be passing towards the thigh over here. Could you understand? So this part is a genital region, for example. This part is a scrotum, for example. This part is a genital region over here. Towards the lateral aspect here will be the thigh. Is it not? This is the thigh, right? So the you can understand fascia later will be attached over here and going downwards in this manner, right? Right. So here you can see that in between the bone, for example, the medial border of the ilium, iliopubic eminence and superior ramus of the pubis over here. Okay, this is the superior ramus of the pubis. Okay, so in between these bony parts and the inguinal ligament, there is a gap over here. Getting it out, right? So through this gap passes this sheath over here, this femoral sheath. Femoral sheath. Okay, this femoral sheath is made up of posterior layer. For example, 2 layers in this manner, femoral sheath, 2 layers in this manner. The posterior layer is formed by fascia iliaca. Fascia iliaca, and then anterior layer is formed by the fascia transversalis. How you can understand over here? The ligaments which are attached to the inner lip of the iliac crest are, one is the fascia transversalis and fascia iliaca in this manner. Could you understand? Right? So the fascia transversalis and the medial most one will be the fascia iliaca over here. Transversalis and iliaca. Is it not? So these will be attached to the inner margin or posterior margin of the inguinal ligament over here. Could you understand? So for example, if this is the iliac crest over here, iliac crest is going in this manner. Okay. It has 2 lips, one is the outer lip, one is the inner lip over here. Inner lip will be giving rise to attachment of 2 fascia over here. Fascia transversalis on the outer aspect and fascia iliaca on the inner aspect. Could you able to remember or not? Could you able to remember or not? Everybody? No? Could you able to remember? Right? Everybody? Could you able to remember or not? Right. Okay. So this fascia transversalis will be going all the way over here and then turns towards the posterior margin of the inguinal ligament and will be attached to the posterior margin of the inguinal ligament. Could you understand? Right? And then the fascia iliaca also in the same manner goes towards the anterior superior spine and turns and attaches to the posterior margin of the inguinal ligament over here. But whenever it is reaching over here, it will be forming a sheath in this manner. Could you understand? So these 2 layers are getting separated over here. The 2 layers will be getting separated in this manner. Okay. The posterior is formed by the fascia iliaca and the anterior is formed by the fascia transversalis. So same fascia transversalis over here, fascia iliaca over here, enclosing a gap over here, which will be carrying femoral vessels and see. See here, these are straight away entering through this sheath into the thigh in this manner. Could you understand? See here, so in between the inguinal ligament and bony part over here, there is a space. Through that space, this femoral sheath will be entering into the thigh over here. Could you understand? You can imagine the adductors and everything coming over here, right? So this femoral sheath contains femoral vein on the medial aspect, femoral artery in the middle, and here will be genital branch of the genital femoral nerve. You will be understanding that later during later part. Okay. So vein, artery, and nerve which belongs to the thigh will be passing in between the space between inguinal ligament and the bony part of the hip bone over here. Could you understand? Could you understand, right? For example, if this is the inguinal ligament over here, this is the bone over here. Could you see that? This is the for example, this is the superior this is the anterior aspect, this is the posterior aspect, for example. This is the inguinal ligament between the anterior superior spine and pubic tubercle over here. And this is the pubis, and this is the rest of the iliopubic eminence and everything over here. Okay. So this is the bony part and this is the inguinal ligament over here. In between these two, there is a space. Getting it down? Through this space only, the femoral sheath will be going downwards in this manner, and femoral vessels also will be going in this manner. Okay. So initially there will be lateral ligament, and then followed by this femoral sheath over here, and then further followed by what you can expect over this part. So deep to the fascia, what structures will be present? Deep to the fascia iliaca, which structure is present? No. Deep to the fascia, only fascia. Don't skip certain things before going towards the fascia transversalis. Deep to the fascia, what will be present? Which muscles? Fascia, iliacus muscle and one more. Covered with the fascia iliaca. Psoas major, is it not? Psoas major will be arising all the way from. Psoas major will be arising from. Psoas major will be arising from.
Body of the.
Psoas major will be arising from. Transverse process of all the lumbar vertebrae and then upper and lower margins of the anterior part of the Which lumbar vertebrae? 4 lumbar vertebrae and only the upper margin of the 5th lumbar vertebra. Isn't that right? Simply to remember, the psoas major will be arising from all the lumbar vertebrae, apart from lower margin of the 5th lumbar vertebra. That's all. Okay, as simple as that. Okay, this psoas major and the iliacus muscle both will be joining together and will be again passing through the gap over here. You can see the gap over here. This gap, this small gap which is present over here, through which it will go and will be inserted onto the femur over here. The muscles will be coming all the way in this manner and will be passing in front of the bone and behind the ligament over here, behind the ligament and in front of the bone, and will be going towards the femur and will be attached to the femur over here. Okay, whatever the area might be. Okay. So through the gap between the inguinal ligament and the bony part, which structures are passing over here. First of all, the lateral ligament over here, and then followed by the femoral sheath over here, and then followed by the iliacus and psoas major muscle. Could anybody is having hip bone, right? Anybody is having hip bone? No? Okay, so okay, fine. But could you able to understand how the space is present over here?
Yes, sir.
Between the inguinal ligament and the bony part? Could you able to understand or not?
Yes, sir.
So you would almost have time. So anybody could you able to understand or not?
Yes.
Everybody could able to understand or not?
Yes, sir.
Okay, fine. Okay. So these are the things you go to the cadaver and see.
Yes, sir.
That's what the cadaver parts can see about. Okay.
Fusion?